Chairperson, ladies and gentlemen, I'm making a presentation entitled Serum Total Bilirubin Concentration is negatively associated with increasing severity in patients with type 2 diabetes mellitus. So it is known that serum bilirubin concentration is associated with diabetic retinopathy in patients with type 2 diabetes. So in this study, the relationships between serum bilirubin concentration and the severity of diabetic retinopathy are investigated. In addition, the importance of bilirubin was compared with factors which were previously shown to be associated with the incidence of diabetes retinopathy, that were duration of diabetes, body mass index, systolic blood pressure, and hemoglobin A1C. 674 patients with type 2 diabetes are investigated. Serum total bilirubin concentration are compared between patients with and without diabetic retinopathy and according to the severity of the retinopathy. Then, multivariate analyses are performed to evaluate the association of retinopathy with total bilirubin concentration, duration of diabetes, body mass index, systolic blood pressure, and hemoglobin A1C. This slide shows the background of the patients. Average age is 64 years, and average diabetes duration is 13.9 years, very long, and average body mass index is 25.5, suggesting that many obese patients are included in this study. Average hemoglobin A1C is 9.1%, very high, and the average of total bilirubin concentration is 0.94, so 0.7474, which is within the reference range of our institution, and more than 70% patients are complicated by hypertension or dyslipidemia, and 41.4% of patients were complicated with diabetic retinopathy, so 19% with simple, and 6% with proliferative, and 21.8% with proliferative diabetic retinopathy, and more than 40% patients are complicated by diabetic nephropathy. So this now I will show you the results. So in this slide, the patients without retinopathy showed a higher serum total bilirubin concentration than the patients with retinopathy. So as shown in this slide, patient without retinopathy show significantly higher bilirubin concentration than the patients with simple retinopathy, and that patients with simple retinopathy showed higher serum bilirubin concentration than the patients with proliferative and proliferative retinopathy. So it means serum bilirubin concentration decreases with the increasing severity of diabetic retinopathy. This slide shows the result of multivariate low-risk regression analysis of diabetic retinopathy. As shown in this slide, total bilirubin concentration as well as diabetes duration and systolic blood pressure are shown to be significant explanatory factors for diabetic retinopathy. So to summarize the results so far, total bilirubin concentration is lower in type 2 diabetic patients with retinopathy. Total bilirubin concentration decreases with increasing severity of diabetic retinopathy. Patients with retinopathy have high blood pressure and long diabetes duration. These results were published in this paper last year. So it is already shown that bilirubin concentration is lower in patients with type 1 and type 2 diabetes with vascular complications. Concerning this, I will show you another data. We made a poster presentation at this year's American Diabetes Association annual meeting entitled Low Serum Total Bilirubin Concentration in Patients with Type 1 or Type 2 Diabetes mellitus complicated by vascular complication. This presentation consists of two studies. One is about type 1 diabetes and another is about type 2 diabetes. So in 131 type 1 diabetes, serum total bilirubin concentration is compared between patients with and without retinopathy or nephropathy, and among groups stratified according to the severity of retinopathy or nephropathy. So in type 293 type 2 diabetic patients, total bilirubin concentration is compared between patients with and without diabetic microangiopathy, that were nephropathy, retinopathy, neuropathy. and between patients with and without macular angiopathy, that was cerebral infarction, coronary artery disease, and peripheral arterial disease. So this slide shows the comparison of serum total bilirubin concentration according to severity of diabetic retinopathy and nephropathy of type 1 diabetes. So the bilirubin concentration of the patients without retinopathy, simple retinopathy, and pre-proliferative and proliferative retinopathy are 0.8 without retinopathy, 0.6 with simple retinopathy, 0.5 with pre-proliferative and proliferative retinopathy. So the more severe diabetic retinopathy, the lower total bilirubin concentration is. This tendency is statistically significant. As for nephropathy, total bilirubin concentration with patients without nephropathy, with microalbuminuria, with macroalbuminuria and renal failure are 0.8 without nephropathy, 0.75 with microalbuminuria, 0.5 with macroalbuminuria and renal failure. So similarly, the more severe nephropathy is, the lower total bilirubin concentration is. This slide shows the results of logistic regression analysis of diabetic retinopathy and nephropathy of type 1 diabetes. So as for retinopathy, duration of diabetes and total bilirubin concentration are shown to be significant explanatory factor for retinopathy. So as for nephropathy, age and total bilirubin concentration are shown to be significant explanatory factors. So these data are published in this paper last year. So from now, I will show you the results about type 2 diabetes. So upper part is about diabetic small vessel disease, and lower part is about diabetes macrovascular disease. So the patients without retinopathy, without nephropathy, without neuropathy show significantly higher total bilirubin concentration than the patients with such microangiopathies. And patients without stroke, without coronary artery disease, without peripheral artery disease show higher total bilirubin concentration than the patients with such complications. This slide shows the result of logistic regression analysis examining the effect of various factors on micro or macrovascular angiopathy about type 2 diabetes. So as for microangiopathy, only duration of diabetes is shown to be significant explanatory factors. As for macroangiopathy, total bilirubin concentration, age, duration of diabetes, and LDL cholesterol are shown to be significant contributing factors. So from now, I will show you another data. So we published these data in this paper this year, entitled Serum Bilirubin Concentration is Associated with eGFR and Urinary Albumin Excretion in Patients with Type 1 Diabetes, mellitus. So as shown in this slide, both total bilirubin concentration, both total and indirect bilirubin concentration positively correlates with eGFR. So the higher eGFR, the higher total bilirubin concentration is. So in this slide, both total and indirect bilirubin concentration correlates negatively with urinary albumin excretion. So the higher urinary albumin excretion rate, the lower bilirubin concentration is. So this slide shows the result of multivariate regression analysis looking for factors contributing to the eGFR. So when total bilirubin is selected as independent variables, use of ARB or AS inhibitor is shown to be significant contributing factors. When indirect bilirubin is selected, indirect bilirubin concentration and use of ARB or AS inhibitor are shown to be explanatory contributing factors. So this slide shows the result of multivariate analysis looking for factors contributing to urinary albumin excretion. So when total bilirubin is selected as the independent variables, total bilirubin concentration, age, use of ARB or AS inhibitor are selected as contributing factors to urinary albumin excretion. When indirect bilirubin is selected, indirect bilirubin concentration, age, hemoglobin A1C, and use of ARB or ACE inhibitor are selected as contributing factors to albumin excretion. So, judging from all data I have shown you today, I think it's safe to say that serum bilirubin concentration is negatively associated with micro or macrovascular complications in both type 1 and type 2 diabetes. So further mechanisms are not known up to now. So one of the hypotheses is as follows. So bilirubin possesses antioxidant and anti-inflammatory properties. Antioxidant properties is exerted by scavenging reactive oxygen species. Anti-inflammatory properties is exerted by inhibiting the TNF-alpha-related induction of endothelial adhesion molecules such as E-serotonin, VCAM1, or ICAM1. So this is the last slide. In conclusion, bilirubin might function protectively against vascular complications in both type 1 and type 2 diabetes patients. Thank you for your attention.